Welcome back. Well, it was a fiery hearing on Capitol Hill today. HHS Secretary RFK Jr. testifying before the Senate Finance Committee, defending his overhaul of the CDC.
If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. I need to fire some of those people to make sure this doesn't happen again. That is what my job is. That's what my mission is. Eliminate the politics from science.
As you can imagine, that didn't go over well with Senator Elizabeth Warren.
Will you tell America that all adults and all children over 6 months of age?
It's not recommended for healthy people.
No.
You're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
I don't know if you could hear that over the crosstalk. $855,000 from pharmaceutical companies. It's the accusation from RFK to Senator Elizabeth Warren. But she had her own supporters there, of course, in the Senate.
This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing.
You're interrupting me. And, sir, you're a charlatan. That's what you are.
Let me speak slowly and clearly so that you can understand me through my New Mexico accent.
That last senator, oh no, he threatened not to give RFK Jr. his special memento.
2 young ladies in Las Cruces, New Mexico, at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it.
He's not going to get the starfish? Here to react, physician and addiction medicine specialist, Dr. Drew Pinsky. Dr. Drew, it's great to see you here today. What do you make of all of this? RFK continued to point out chronic disease, chronic epidemic, and all that time those senators have sat there and oversaw this problem in our country.
That was precisely his point, but still devastation that he didn't get the starfish pen. I feel so terrible for him. The reality is he has never diverted from his message. World-class science, if people aren't coming along, or if they're politically motivated, or if they're ideologically encumbered, we have to move them aside. That's it, simple as that. Now, what I saw in this Senate hearing, I'm not sure, because as of somebody working in healthcare for 40 years, what I saw was obfuscation. These people were political grandstanding, that they wouldn't allow him to answer questions. They were just throwing out positions and accusations. And number 2, a grotesque lack of understanding of how our healthcare system works. Secretary Kennedy said a couple of times, you're making things up, and they were. They were absolutely making things up out of thin air. In fact, there was only one senator, well, 2, Ron Johnson, who actually demurred on the topic of healthcare, but he knew what he was talking about. But the only other senator that knew what he was talking about was the Rhode Island senator, who was talking about allocation of CMS resources and end-of-life care. He had very specific questions. They were extremely valid, and they will move the ball forward if we're able to do something about those things. The rest of this was strictly political and obfuscation.
And Dr. Drew, about the vaccine, primarily about the vaccine and CDC. Well, CDC is the Center for Disease Control. We have a chronic disease problem, not simply a problem of medicine, but a problem of chronic disease. And that's what he continues to bring up. And then when it comes to the solution, all they're focused on is the vaccine, which we should point out. In that cross-examination from Senator Warren, he said the boosters, for example, for COVID, are available. But that doesn't mean that I have to be required to recommend them for healthy or young people.
Look, Will, what does the CDC do? What is their function? Do you have any idea what their... that's part of what I was observing. Nobody seems to understand what the CDC role is in healthcare. Do you have any idea? We report on it all the time. Do you know what their original charter was and what they're supposed to do now?
Please share.
They originally were advising how to eradicate malaria. That was the original charter of the CDC. Now they are to advise, strictly advise. They're to oversee the public health system. Public health is not healthcare. It is not the healthcare system. It's an advisory panel to help physicians make decisions. And you know what the physicians at their liberty to do, regardless of the FDA, regardless of the CDC, is to do whatever he or she thinks is in the best interest of the patient sitting in front of them. That's it. That is our charge. I taught medicine for 20 years. Never once did I ask one of the residents, what the CDC tell you to do about that? I might have asked about CDC data, but the CDC is not healthcare. Public health is not healthcare, and people are terribly confused. And these senators are grotesquely confused about what these bureaucracies are charged to do.
Incredible, incredible insight. Great. Thank you so much, Dr. Drew. Hey, it's Will Cain. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Cain podcast for full episodes right now.